Break it down. When you say the system wasn't built for us, specifically, what do you mean by the system?
So Nicole Anna and her 1619 project describes it to a T. The hospital was not built for Black people. Literally, when we were freed from slavery, they built hospital systems and they would not allow us to walk in the door. The goal was to watch us die in the streets, to remind us that we are supposed to be slaves. And so since y'all wanted this, y'all can have it, but you'll die in the streets from disease, bacteria, all of those things. But you can't come into this system.
We'll discuss race and how it plays a factor and how we didn't even talk about this topic because we were afraid.
A Black executive perspective.
BEP is on fire. Our audience is growing fast and the impact is real. Now is the time for your brand to grow with us and reach a highly engaged, influential community with real spending power. Don't miss this moment. Email us today at media@TonyTidbit.com. Let's make it happen and put you and your brand in front of the people that matter. We are coming to you live from the new BEP studio for another thought-provoking episode of a Black Executive Perspective podcast, a safe space where we discuss all matters regarding race, culture, and those uncomfortable topics people tend to avoid. I'm your host, Tony Tidbit.
And I'm your co-host, Chris P. Reed. Before we start into this riveting episode, we want to remind you to check out our partners at Code M Magazine. Code M Magazine, whose mission is saving the Black family by first saving the Black man. Make sure that you check them out. That's Code M Magazine, 2Ms.com.
Definitely check them out. And, everyone, one of the things in America that's not discussed is much that Black women are dying at a disproportionately high rates during pregnancy and childbirth, often from preventable causes. This is not about individual behavior, though. It's about systems. So today, we sit down with Dana M. Langford, certified nurse, midwife, and founder of the Village of Healing, to examine the history of racism in healthcare, the erasure of Black midwives, and the structural forces that continue to fail Black women. More importantly, we'll explore how she is rebuilding a model of care from the ground up. This episode is not just about disparities. It's also about solutions, ownerships, and saving lives. Dana Langford, my sister, welcome to a Black Executive Perspective podcast.
Thank you all so much for having me. I'm blessed and honored to be a part of this and excited for the conversation.
All right, before we get too deep into this deep conversation, because it's really pivotal, tell us a little bit about yourself, where you currently reside, and things of that nature.
So I'm Dana Langford. I am a certified nurse midwife, currently residing in Cleveland, Ohio. So out here where it's about 10 degrees, it feels like it's snowing. I am single, so no husband, no kids. I do have a dog that is my child, who I love dearly, so Royal Boss, who we had to leave at daycare in order to be able to do this and talk to you all today. So, and I currently, like I said, will serve as the CEO and also as a certified nurse midwife at Village of Healing and the Village of Healing Center.
That is awesome. Now, I'm sitting here laughing because the dog is at daycare.
Yes.
All right.
Yes. So
I mean,
I'm
you're
an
kidding
only
me now.
child.
Right? Okay.
So I now have a dog that's an only child. So I know what that feels like to want to be able to have a conversation and play and be around others. And so I wanted him to be able to have that. And I wasn't about to get a second dog. If you got a dog, that's worse than a human.
Well, listen, I can tell you this flat out. If you get a second dog, they already know what they're going to be getting. They're going to be getting pampered.
Yeah, exactly.
All right? Flat out, right?
And I ain't got it. I ain't got it. So we just going to go with the one and drop them off at daycare every day.
So why don't you tell us a little bit? Because one of the things is you have a fantastic background. So why don't you walk us through your background?
So I went to Eastern Michigan University. I have a bachelor's degree in sports medicine. Funny story behind that. I thought I was going to become a lawyer because I love to argue. And so I was going to school to be a lawyer. I went to, in high school, I went to the guidance day, the career day. And I went to the lawyer's room and they said to make sure you get your bachelor's in something else before you go back to law school. So I walked into this room around athletic training, heard the story of this woman that said she worked with athletes all day. So I decided to go to school to become an athletic trainer so I could meet a rich husband and never work again. That did not work.
Okay.
And actually backfired big time. So I left Eastern Michigan with my bachelor's there. Came home, I worked for a women's shelter and started working with the nurse practitioner at the women's shelter with the idea to go back to becoming an OBGYN. But working with a nurse practitioner allowed me to really see what advanced practice registered nurses are able to do differently than doctors, and the amount of time and talent they get to spend with patients. And so then a friend of mine delivered her baby with a midwife and invited me into the delivery, and I absolutely fell in love with the profession. So I returned back to The Ohio State University, received my Master's of Science in midwifery. And when I went back to school, even my personal statement just talked about how I only wanted to work in the Black community. I only wanted people to see me that looked like me. And so I left there and moved down south for about 7 years. I practiced. God blessed me to be able to practice in only majority Black practices with Black providers. And the care that we were able to provide just differently was amazing to me. And so I got a little homesick. My grandmother got sick, moved back home to Cleveland, Ohio, and really started getting into infant and maternal mortality. But I was looking around the room and nobody looked like the community that was being ravished. And the conversations and the victim blaming and all of those things that was happening in those rooms. But I saw Black organizations coming forward, and it was Black women leading the way. And they had real results, but they were being told it wasn't going to work and things like that. So I realized that I needed to not be a part of the system anymore and the problem, and I needed to become a part of the solution. So I founded Village of Healing and the Village of Healing Center. We opened our doors February 14th of 2022 with the goal to see of about 40 women to put my stamp on infant and maternal mortality in Cleveland, which is one of the worst in the nation. I ended up seeing 640 women that year. And so I recognized this was a need and the community wanted it. And so from there we grew and we added primary care, we've added mental health, we've added pediatrics. We now have 2 sites as opposed to the one. Our numbers double every year. Our outcomes are simply phenomenal and unheard of. And so we're just excited about the care that we've been able to provide, all led by Black providers taking care of Black patients.
That is awesome. That is awesome. And thank you for that. Really, really appreciate it. I think I turned my nose up. I don't know if you saw it or not when you said The Ohio State. You know what I'm saying, my girl? Number one, you go to Eastern Michigan, which is in Ypsilanti, right? I'm from Detroit, Michigan, okay? Yes. Then you're going to sit here and talk about The Ohio State University. You kidding me?
There's only one.
Oh, you kidding. But you know what? I'm going to forgive you because you're saving lives. All right? So I'm going to let that slide. But let me ask you this, my sister. You just, again, you went through your career journey, and you're doing something that is fantastic, right? And not even trying to make light of it. It's really, really affecting and changing lives. You're busy. You got a lot of things going on. Obviously, your practice is your baby outside of your dog. So the question I have for you is, why did you want to come on a Black Executive Perspective podcast, talk about this topic?
I think in the last year or so, as we've seen the administration change, we've seen the funding landscape change, and we've just seen the conversation change around healthcare disparities. I mean, literally, it's coming down off of sites. Black people are losing the sight. We're losing sight about what can be and what is. And I also think that people don't understand what Black healthcare is, and it's that different. It's a specialty. It's one that has to be cultivated, created, and then explored, and it has to be implemented in our community if we truly want to see the difference in healthcare disparities. If we continue to go down the path we're going down, right now when it comes to chronic disease, when it comes to maternal and infant mortality, all of those things, Black people are at the top. And we're not just at the top, we're at least double in all the categories. In Cleveland, Ohio, our black babies are dying at 4 times the rate than other babies. Nationally, it's 2 to 3 times the rate. The same with maternal mortality, is 2 to 3 times the rate. In states like New York, they're at 12 times the rate. And so we're losing sight of that conversation because the narrative is changing. And so I wanted to come on here to, number one, bring to light that Black healthcare is available, that it is needed, and that it is expanding across this country. This is the solution for healthcare disparities. Black providers caring for Black patients. Village of Healing has shown already in our short 4 years that we are the answer. And so just wanted to highlight that and bring that to everyone's attention.
It's time to rethink your protein. AgileLab's protein bars are crafted with high-quality protein, double the leucine, and enriched branched-chain amino acids, essential for optimal muscle recovery. Finally, a protein bar that works as hard as you do. So visit agilelabs.com and use the code BEP to get 20% off. That's agilelabs.com, promo code BEP.
Well, listen, to be fair, I mean, if that was the appetizer, I hate to see what the full entree is, right? But more importantly, thank you for all that, and we're glad you're here. So look, it seems like me asking you, are you ready to talk about it? Makes no sense because you've already dove in 2 feet, right? But I'm gonna say it to you anyway, my sister. You chomping at the bit. You ready to talk about it?
I'm absolutely ready to talk about it.
All right, my sister, let's talk about it. So one of the things, though, I think is very important, right, is when we use the word midwife, a lot of times people don't know what that is. They're thinking, 1700, 1800. They're thinking, and so why don't we break that down first, right? What is a midwife? And then more importantly, why did you decide, especially after you were looking to get into sports, why did you decide that this was the career that you wanted to make?
So first and foremost, let me say this. 1700s, 1800s, those are the midwives. Black midwives bought the profession over here on slave ships. And so we were delivering all of the babies in the South, in America at a time. And
so just so I'm clear here, right? The midwife, just so we clear, the midwife helps deliver, talk the different, because when we say midwife and wife, what is specifically a midwife? Let's go there, then give me the history.
All right, so midwives, and in my profession, so I'm a certified nurse midwife. There are multiple different types of midwives. I am a master's degree prepared registered nurse. Yes, I deliver babies. And I deliver babies in hospitals. So across this country, certified nurse midwives deliver babies in hospitals, and we do home births. And so we are registered nurses that are master's degree prepared. Not only do I deliver babies, I take care of women. Midwife literally means with women. And so I take care of women from the cradle to the grave. And I can do about 30 days of newborn care. But after that, from puberty on, is when I take care of women. And we do that through assessment, diagnosis, and treatment. And so in some states, we have to work in collaboration with MDs. In some states, we practice completely independently. And so yes, we provide health care. Health care, I need to stress that.
No. So, and we're going to dive deeper into it, right?
Yeah.
But just to be clear, so a midwife delivers babies. So what's the difference of somebody going to the doctor to have their baby delivered, all right, versus having a midwife delivering the baby?
I think it's our approach. And so in midwifery, we go into every pregnancy like this is normal. Pregnancy is normal. Doctors might go in waiting for you to get sick, and they don't as normalize it. Also, it's a money thing. This country is built on money. And so for hospitals, they allow midwives the opportunity to spend more time with patients than the traditional doctor does. Got
it. So that's where the caring and stuff comes from, correct?
Absolutely.
Now, you were just diving in. Now I'm ready for the history, my sister.
Okay.
All right, so why don't we...
I got to shout out Black midwives. We bought the profession.
No, but that's what I want you to do. I want you to dive into the history. Where did midwife come? Because you were chatting about it. Hey, midwife came from slave ships. So let's go into there a little bit as well.
Yeah, so we bought the profession over here. We were delivering most of the babies, if not all. And then white obstetrics was introduced into the country. And so what did they need? They needed the patients to practice on. And so at the time, of course, white individuals wanted to associate more with the profession of obstetrics and gynecology. So they started doing more of their care with OBGYNs. However, the black folks, we stayed with our own people. And so we wanted to deliver with our own people. But in that time, again, white obstetrics and gynecologists decided they needed someone to practice on. And we still see that kind of today, right? Where you see the most resident clinics are going to be in poor neighborhoods or black neighborhoods. And so they needed a population to practice on. And so there was a systemic eradication of the black midwife through racism, calling black midwives incompetent, calling black midwives uneducated, saying that we were the ones that were creating the infant and maternal mortality rate. And so they implemented this system of education, which in the 17 and 1800s, we weren't even allowed to read, let alone to have this education. So we went from being the number one profession delivering midwives to now we only account for about 5 to 8% of midwives in this country.
Now, let me ask you this, though. So what I'm hearing is that black women brought midwife to the forefront, right? Mm-hmm. And was doing it not just with black families, but with white families as well, correct?
Yes.
And then what I'm hearing is that all of a sudden, the white doctors and stuff wanted to get in on the practice. So
Absolutely.
they demonized, black women as midwives, saying that they're ignorant and this and that and the whole 9 yards, right? And then they ended up taking away the market share in terms of is that what I'm hearing? Is that what I'm hearing, my sister?
Absolutely.
Okay.
You couldn't, and I'm gonna steal that for my presentations. Market share, because that's what it's all about. They took away the market share. Yes. Yes.
Oh, okay. All right. And so at the end of the day, now, well, let me ask you this. You've created, I don't want to say created, but you've dove into it, and now you're promoting it, and you have a facility that's 100%. But talk a little bit about, because one of the things that you talked about is what we call the bodies built on origins and modern geology or gynecology, right? And then you have some names, it's Lucy and Betsy. Talk a little bit about that.
So again, we built modern gynecology on the backs of black women. And so what we know is that enslaved black women were sold to a white physician named Marion Sims. And he came in and promised that he would fix these conditions that these women had, these enslaved women, that the torturers needed them back out in the fields working, right? So they were property, and they weren't able to fulfill their duties as property because of these conditions they had received during delivery. And so they put them, he came into town on his white horse. That's the way I imagine it happening. And he promised that he would get these black women back into the fields. And so what we know is some researchers said, and some historians have said that he practiced on about 30 women. But let me explain to you what that practice looks like.
Yep.
He took over 30 enslaved black women and tortured them. He did these procedures on them with absolutely no pain medicine. He tied them down so that the pain wouldn't cause involuntary movements. These women were then rotated out to recover, a lot of them getting infections, being in agonizing pain, again with no pain medicine. And this went on for 5 years. So in the beginning, he had white physicians that would come and gawk at his awe and praise him, but it took so long that they could no longer come in and be his assistant. And so what he did was he chose these 3 black women, Anarcha, Lucy, and Betsy. Anarcha was about 16, 17 years old when she had her first surgery. So she was a child. And he took them and rotated them in as his assistants. So they were forced to essentially watch him torture their sisters. And so he perfected this stitch. Some historians have said over 30 surgeries were done on Anarcha, the youngest of them. Moved up north, became known as the father of modern gynecology, wrote all type of journals, all of that. However, it wasn't until later in life when he wrote his memoirs that he finally admitted how he had done it. But by then he was known as the father of modern gynecology.
So in other words, he used them as guinea pigs to practice his craft, to become an expert at his craft. right? That's what I'm hearing. And
Yeah.
then this is one of the reasons, and this is just one example of many examples where Black people don't trust doctors and stuff to that nature because we've been used as experiments before, and there was a syphilis thing. I mean, we can go on and on and on and on and on, right?
If you like what you hear and want to join us on this journey of making uncomfortable conversations comfortable, please subscribe to a Black Executive Perspective podcast on YouTube, Apple Podcasts, Spotify, or wherever you get your podcasts. Hit subscribe now to stay connected for more episodes that challenge, inspire, and lead the change.
And so this causes an issue in terms of, and I don't want to say, obviously we can say capitalism, money and all that type stuff and lack of health insurance and this and that. But at the end of the day, you can also look at the psychological factor of the fear of going to a doctor and not knowing if they have their best interests at heart.
Absolutely. I think, I just said this earlier today. What happened is that we stopped telling the story. So all we know is don't go, but we don't know why don't go, right? We didn't know about the midwife. We didn't know about Anarcha, Lucy, and Betsy because the story stopped, Tuskegee, all of that. The story stopped telling. And so when it got to our generation, it was don't go. And so we got to keep the storytelling going.
I love it. it. Chris?
Yeah, so let me ask you this before we move off of kind of how you got so passionate about this. Give us a little bit about your trip to Ghana.
Oh, it was life-changing.
Okay.
And it was the reason that I started Village of Healing, actually. Yep. One of the many reasons. But I went to Ghana and I visited the slave dungeon. And literally we went to the room where they held the troubled women. And so as we were in this room, I said to myself, you do know you would be in this room, right? Like these were the quote-unquote disrespectful, misbehaved Black women. And there was a hole in the floor. It was very dark. If you've ever visited, the floor is lined with years and decades of feces and urine that has hardened over time. The hole was for the women to use the bathroom. And they used a boulder essentially to close it, which makes it dark and hot. But it was in that moment that my ancestors said to me, so we didn't go through all of this for nothing. And so now it's up to you to be a good ancestor. And so it was amazing, life-changing. And I got back and I just knew I had to do something, to make them proud, right? They didn't go through all of that for no reason at all. And then secondly, to make sure that I was a good ancestor to those that come after me.
And that just notifies that the Black experience is multinational and worldwide, how they diminish our value and things of that nature. So when you talk about racism, a lot of people think it's just America and they just racist against us here and that's that. But this started somewhere else and has proliferated over here. Yeah. So you came back here to at least stop it here where you could, right? So
absolutely.
How do you combat the fact that racism is not anecdotal, it's structural, and the CDC and other bodies don't necessarily give it its just due?
So I think that, most importantly, it was creating our own system. Mm-hmm. And that was what we needed to do. What we needed to do is people talk about dismantling their system. Well, how do you do that? Financially. And so by creating our own system, what we've done is we've said not only are we dismantling it, but we're going to completely step away from it because it's not my job to fix it. So I'm going to take care of my own people. Y'all fix y'all system. And as needed, let me say I still need them. And so we have certain doctors that we work with inside the system and are able to advocate for our patients when we need to refer them back. But it was stepping away, and we've got to completely deconstruct. We've got to completely bring it down, tumble it, and then rebuild it. What we're trying to do is we're trying to fit into a system that was never built for us. And so how I'm combating that is building us a system that we could work in collaboration when necessary with their system.
Let me ask you this, because when we kicked off the episode, we talked about Black women dying at a high rate from preventable causes, right? Why don't you talk a little bit about what are some of those causes? Talk a little bit about that.
So the big one is, the top two for Black women, because I always like to give the top two, is hypertension and preeclampsia or heart issues. And then secondly, mental health. Those are the top two. In the state of Ohio, more than 65% of those deaths are deemed preventable. So it was just simply listening, hearing, and we see that, right? And it didn't matter about socioeconomic status. We saw that with Serena Williams. That all they had to do was listen to her, right? She said, I know my body.
I know my body.
I have blood clots.
Right.
And that's what's happening right now. And she was ignored.
Let me ask you this, though, Dana. Sorry not to cut you off, but a lot of times people push back on that, and they cite the reason because they don't go to the doctor. All right, and so that's one of the main. And again, I'm just, you know what I'm saying. They come back and say, "Well, hey, you know what? The rates of people going to the doctor and getting their checkups and stuff to that nature. That's one of the reasons why these numbers are high." What do you say to that?
So we've done the research. We've dispelled it, and we've looked across the board. We've looked at socioeconomic status. They've looked at obesity rates. They've looked at all of those things, even down to smoking, right? Nobody wants to say racism. We know that, right? And so they're going to look at every single thing to dispel it. We've looked at rates of insurance. We've looked at times when you enter your care, especially in pregnancy. And what we've seen is that it is a Black racism thing. And it's been disputed across the board. And so until we address that, we're going to continue to see what we see. And that's where we come into play at Village of Healing.
Let me ask you this, though. Is it a situation where they're just ignoring you, knowing you? Or do you believe it is and I don't want to diminish it by saying it, a playbook for white women versus a playbook for Black women? Same age, same college education, all of that. But if she's Black, this is kind of the route I'm going to take versus if she's white.
Yeah, I think that it's individually based.
Okay.
But I think that that's due to the system. Okay. I think the system rewards bad behavior. I think that, what we see is that those individuals with bad behavior in the system and benefit the system because of that bad behavior get continuously promoted. And then that bad behavior trickles down. And so I don't even think it's a playbook. I think we walk in with our own preconceived notions. And so when Black women are thriving in pain, we're being extra. We're being dramatic. It's just like when we see Black doulas come in versus white doulas, you're informed and educated. When you're Black, you're being a troublemaker. And so I think that has nothing to do with the playbook, but it has to do with our preconceived notions, our racist thoughts, and then it trickling down from the top.
Let me ask you this. So, and again, so number one, I'm so happy you're here, and you're highlighting something that's very important. But here's the thing: you're not just highlighting it from an emotional standpoint. You're providing facts and data and stuff to that nature, right? That's indisputable. That's what I love too, right? Let me ask you this, but let's break it down, because one of the times we say the system wasn't built for us, right? And I'm sitting here. It reminds me, growing up in Detroit, I think it was a cut. I forget who made the song, The System, or something like that. I can't remember, right? Or you can think of The Matrix. Break it down. When you say the system wasn't built for us, specifically, what do you mean by the system?
So Nicole Anna and her 1619 project describes it to a T. The hospital was not built for Black people. Literally, when we were freed from slavery, they built hospital systems, and they would not allow us to walk in the door. The goal was to watch us die in the streets, to remind us that we are supposed to be slaves. And so since y'all wanted this, y'all can have it, but you'll die in the streets from disease, bacteria, all of those things. But you can't come into this system. And what happened? Black folks do what Black folks do. A Black woman went and created our system to treat us and to care for us. So if the system was already built, hospitals, to not welcome us, what do we now expect 200 plus years later? Right.
My girl, now I'm going to turn it back on you, right? I'm going to steal what you just got finished saying for my presentation, all right? Because you broke it down. I love it. Here's the thing, though, okay? So you remember, Krista, you probably remember this. When I was a kid, what was the brother's name? He invented blood plasma. Charles Drew, Dr. Charles Drew.
It might have been Drew, yeah.
Okay, and he invented blood plasma, so you can have a blood transfusion. He invented it. right? And then there was the story that he got into a car accident and he needed a blood transfusion. And the closest hospital was a white hospital, and they wouldn't treat him. And he ended up dying. He invented it and couldn't go to the white hospital.
Right.
They wouldn't treat him, and he ended up dying. Now, years later, they said, oh, that wasn't true, blah, blah, blah. But at the end of the day, it speaks to what you were saying here, right? And, we know that those things have happened. We know those things, and not even... I think also to the key, too, is going back to the what Chris asked you about was more about, are you looking at me as a patient or a troublemaker, right? Are you really concerned about when I say I got a pain in my shoulder? Is it really like, are you really diagnosing me? Or you're like, you'll be all right, take this apple, go home, right? And so I saw you, but I don't really care for you. Right? And so I think that's what I'm hearing you say.
Yeah, it's your well-being. It's not at the forefront. When white individuals walk into the room, they don't see their niece. They don't see their daughter. They don't see their sister. They see a black patient, period, point blank. And so even when they say I don't see color, it's still disrespectful and rude to me. Because when you would come into my room as even a black patient, this is where Village of Healing comes in. It's the specialized care. Black healthcare is a specialty. And so by you saying you don't see me, that's a problem too. So yeah, that's all it is. It is that when white individuals care for us, they don't see their family member. They see the troublemaker. They see the aggressive patient. They see all of these things instead of trying to get to the bottom of why am I asking you all these questions? Why am I standing back and thinking, oh, I don't know about this, but also not taking into account, which is what I always present about, all of the other systems that we have to endure racism in before we even walk in the door of a hospital system, and how we bring all of that experience into the healthcare system.
Let me ask you this, because we had a guest on our show not too long ago named Dr. Will, and Dr. Will said something that was so wise, and I'm going to provide it to what you're doing, and it was about voting. And he was like, listen, they've convinced you that your vote don't matter, but if your vote didn't matter, why would they try so hard to stop you from doing it? Like, come on now. Yeah. So my question to you is, if they're showing that they don't really care about us in their actions, but we talked about market share. If they really don't care about us and didn't want to treat us, why not be happy with what you're doing and take your people in? Why is it resistance to people like you trying to make sure that people like us stay alive and thrive?
Well, it's the same thing with voting. I think it's white individuals. It's our own internalized racism, right? We think white is right. And so we want to align with that, the perfect example is my grandmother. Okay. Before I became a nurse midwife, my grandmother used to always say her doctor's got to be white. Because they're going to know more information. They're going to know everything. She need a white doctor. I don't want no nurse practitioner. I don't want none of that. Give me a white Jewish doctor. And then I became a nurse midwife, and I'm able to have conversations where I explain it to her, get her connected with nurse practitioners. She was like, you know what, this ain't so bad. But it's that internalized racism, right? And so it's the same thing. If what I was doing was incompetent and wasn't good, why are all these systems, including philanthropy, including funding, all of that, so targeted against the black nonprofit systems that are trying to combat these disparities?
Here's the thing, though. You said the key thing, though, right, is that we are our worst enemy.
Absolutely.
Okay, it's because we fall for it, right? And then we start believing it, right? That they gotta be like this, or because I don't want trust. It reminds me back in the day when, I don't know if you guys saw Sanford and Son, right? Sanford and Fred had a bad tooth, right? And he was like, I don't want no. He said, I want to go to a white dentist, all right? And he said the brother must have, he must have good. He didn't go to regular dentist school. He went to, so got some correspondence courses. And stuff to that, and then they did a 180, right? The white dude ended up going to the correspondence course, and the brother actually was the full dentist, right? And so, but that's real, though. To be fair, all right, that's real. And so when you have that and you think that, then at the end of the day, and I'm hearing midwife, and I'm hearing what you do, I'm thinking, oh, you ain't qualified, all right, to take care of my sister or my mother or whatever the case may be, because they telling me this shit is voodoo. Or they telling me, I'm just being straight with you, right? Yeah. And so at the end of the day, tell us how do we need to educate ourselves?
Well, I
on
think
these things?
the biggest thing is to recognize that when you have somebody that looks like you with your similar lived experience, that actually cares. Because still we know all skin folk ain't kinfolk, right? We know that. But
And that they're not all qualified leaders. Be fair though, too.
Right.
All right, let's be fair. Let's be fair.
But when you have it, right? When you have it. So for Village of Healing, we have the data and the outcomes to back what we're doing. We have a 95% term birth rate, right? Most cities and states are even shooting just for 90. And they're striving to get that. We easing into 95%. We have a hemoglobin A1C, so our diabetic patients, 75% of them are controlled under what the government tells us controlled is. So if you find somewhere that has the data, that has the outcomes, that has the word of mouth, all of those things, then we have to also understand that we are all we got. We are going to take care of each other way better than anybody else. And here's also the other thing. I mean, let's be serious. Specialties usually have less than 1% of doctors are Black. And so what we're able to do at Village of Healing is still go back into these white systems and be able to talk, communicate, collaborate, and do all of those things. One of our partners used to have the reputation in Cleveland of being one of the most racist systems. They have been the best to me, and that's Cleveland Clinic. I can send them an email. I'm getting 9 emails. They figuring out how to get it done, right? But that's the communication and the relationship we've been able to establish. So we're not even saying come to us for everything, don't go to them for nothing. But when you come to us and I'm able to say, this is too much for me, I'm able to refer you back into that system, but now I can have a one-on-one conversation. And now I can advocate for you in a way that you might not be able to do yourself.
When you created this Village of Healing, it was a radical concept, right? And it may have been tough for you, and there was no blueprint, and you figured out something, and it was on your spirit, and damn it, you made it happen. How do you now, as you've built all these years, bring in new people from school and bring in new young ladies and turn radical to rational? Like, this is the best thing. This is the most rational decision to make, so they don't feel like they got to climb that mountain and cuss these folks out and all this and all that. How do you then create a pathway or a bridge for the next generation as we build forward?
So I think the biggest thing is, outside of healthcare, academia is probably the second most racist institution, right? So by the time Black folks graduate from as advanced practice registered nurses, they're looking to go completely away from predominantly white institutions, and they're looking for Black folks. Okay. They're looking for the institutions that have the most Black folks. And we're very clear in our interview process. If you can't sit at the table and tell me more about Village of Healing than I can tell you, then you haven't even done the research. You don't even understand my mission. You don't understand all of that. So we're very rigorous. Usually we look for individuals that seek us out. And that was one of the biggest things that funders asked. How do you continue this? How do you grow it when there's not even enough Black providers? But what they don't understand are Black providers are hungry. We are the ones that are in these Black neighborhoods, in these white institutions providing care. We know the care that our patients deserve. We know the care that our communities need. And so that's why we're forced to go in these white institutions, because places like Village of Healing don't exist. And let me say, it is still very much a radical idea, Chris. It is still very much transformative, but it is radical. And that's the fight that I'm doing now.
Let me ask you this, because when you say, and thank you for the last statement, because that's an excellent point, right? It's still radical, right? It's still a fight. So when it comes down to getting paid from the insurance company, talk a little bit, is that an uphill fight, right? For the modalities and stuff to that nature? Or is it, my bigger, broader question is, has the system accepted your practice, right, in terms of what you're doing? So this way you are being paid correctly, you're being paid on time. They're not because to be fair though too, they can do that, right? They'll push back and say, hey, this ain't right, and we ain't paying you this, or we're only paying you half of this. So talk a little bit about that as well.
So I think we recognize late but good enough and enough time that we had to spend money to make money. And so originally we were trying to bring in our own billers and coders because we wanted to pour back into the community, and we wanted to hire folks from the community. But we recognized that as a small practice, we just didn't have the time nor the capacity to do that. And so we have brought in a billing and coding company who also, and then a credentialing company that negotiates our contract rates for us. But here's what I mean when I say that people don't understand Black healthcare. So I'm in a city where there's 3 very large hospital systems. They take up about 20 blocks each. And yet still philanthropy doesn't understand that only about 60% of what I bill out is brought back to me in reimbursement. They understand it with the hospital systems. And so what we see is $40 million gifts given to hospital systems, $10 million gifts given to hospital systems. And at this point in time, I'm scraping for 20 and 50,000 to fill that gap of reimbursement. And so that's what I mean when I say it's still radical, right? Because I think that a lot of times people don't recognize that I'm still a healthcare system. I can still go toe to toe if given the opportunity with the 3 large systems, but I just need the dollars to be able to do it.
Let me ask you this, though, Dana. So, because you bring up a good point, right? And a lot of that, in today's world, when you have big money, you have a lobbyist, right? And they go down to D.C. and they lobby, try to get people, take people out to drinks and try to, start talking about these things. That costs a lot of money to do. Outside of your organization, what is there other practitioners across the country doing the same thing? And if so, are you guys banding together? Are they industry events and stuff to that nature to be able to get the word out more from a broader standpoint?
So I think the Black midwives are doing a good job. We're starting to band together and figure out birth center equity. Shouts out to Leslie Welch. But she has brought together individuals that want to do birth centers and Black-led birth centers. And so she has gotten, a lot of backing and steam behind her. So we see birth centers are doing really well. I will say this, Village of Healing is a unicorn. And we've looked and we've searched high and low.
You haven't found
it.
We
just don't see it.
You haven't found it.
If it is Black-led, it wasn't Black-founded. And if it's Black-founded, it's not Black-led now. And we have both. And we're also in our 4th year. So we just celebrated our 4th year anniversary this month. And so we're still pretty new. And so we're still learning how to do things. We even tried to invest in the lobbyists, but it just wasn't financially feasible for us.
Right.
Because that's a long end game.
Exactly.
And so we just didn't have that.
Got it.
Let me ask you this, because you are still new and powerful and growing and learning as you go. Is the dream or is the goal, because the issue that you're facing in Cleveland is great that you're taking care of that for our folks in Cleveland, but I got folks in Illinois. You know what I'm saying? And I currently live in Texas. When we gonna be talking franchise, Dana? When you gonna franchise? You know what I'm saying?
Exactly.
What is the dream?
I'm all about it. Okay. I think right now, the biggest things is I just need the investment. I need the philanthropy dollars to be able to help us expand. Like when I heard about Serena Williams investing in maternal health, but she did it through tech. I just wanted to get to her to be like, no, you have to invest in the providers and the people. Because what's happening is everybody's bringing technology into it. And so what that does is going to remove people even more from being humans. It's going to remove the humanity that's required in order to provide the care, especially in the Black community that we do. So to answer your question, Chris, I truly believe that Village of Healing should be in every single urban city. There should be one location in every urban city across this country. The outcomes to bag it, I'm going to continue to build those outcomes, continue to build what we have. But what I do know is Village of Healing is the solution. And that's how we're going to see disparities decrease.
My sister, I mean, when you're running for president, right? I mean, at the end of the day, you got the shit.
Well, we saw how that went with Vice President Kamala Harris. That ain't happening no time soon.
Here's the thing, though. Let me ask you this, because what it's not even what I'm hearing, it's what I'm seeing. I'm seeing a strong woman who's passionate, right, and has 2 feet in cement. All right, that this is her purpose. And at the end of the day, I hear you in terms of all the things that you do, all the things that your organization does. I hear you, the lives that you're changing. I hear you in terms of all the data, the facts. I hear you in terms of, hey, we can scale this, and that. But here's the kicker. You're the one. See, the bottom line is it's all because of you, my sister. Okay? You have a special gift. Okay? You do. And I'm interesting. I just want to, because here's somebody who's looking to get into sports, right? And next thing you know,
sports. It was the money. It was the marriage to the man for the money. It wasn't. I would have did hockey.
But even in that, so that even makes it worse. All right, because you were trying just for the money. All right, and the man. All right, and now your love of humanity. Mm-hmm. And your love of your sisterhood is just phenomenal. That's my point. Okay? Because it's not that I hear what you're saying, that hey, we're the difference and we're a unicorn. You're a unicorn because of you. All right? You're the difference. And that's what people need to be doing, investing in you. All right? Because you can throw a building up. You just got to finish saying it. Hey, they can put some tech in there. But at the end of the day, if you don't have the right people, it won't matter. Right? So let me ask you this before we get to final thoughts. Why don't you walk us through like all the different solutions and things? Give us some examples of how you're changing, African American women's lives and how you're setting them up right for them. When we start off proportionally high in terms of deaths and stuff, talk a little bit of how you now setting that, bringing those numbers down, and more importantly, making sure that they are on the right track of great health care.
So I think first and foremost is that a lot of times in this country, especially, people only care about Black women or women in general, but especially Black women for 10 months when they're pregnant. And that is the wrong mindset to have about ensuring healthy pregnancies and healthy children. We believe, and I believe, that Black women are the CEOs of our families. We believe that when you have healthy Black women, that is the trickle-down effect. That healthy Black woman, then it trickles down to her entire family, which is why we integrated primary care and pediatrics. So we now see men, women, and children. Because we know that when families are healthy, the Black community thrives. And so what we're doing is investing in women and caring for women holistically. So when a woman comes and sits in front of me, I don't see just motherhood. I see, how do I get this woman healthy mentally? How do I get this woman healthy physically now, if she chooses pregnancy, and after? And then how do we ensure that her family now is incorporated? We believe that only 20% of what we do inside of that room truly affects healthcare. It's the 80% of life happening around them. And so we've also been able to insert ourselves in that and figuring out how do we connect you with resources? How do we get you connected with the community to ensure that you are 100% healthy? And so that is the way that we are changing healthcare. We are not treating the symptom. We are not treating the condition. We are treating the Black woman and trickling it down to the entire family. We want to ensure that Black families are healthy, surviving, and not only surviving, but thriving. And that's how we get Black excellence.
In the idea of making connections, you said something so powerful, and that's the community. In the idea of making connections in the community, we are very, very, as a people, suspect of new things, right? So how did you go about your plan to ingratiate yourself into the community to where you could have these, hey, I got a guy, I got a lady, go talk to her, you know what I'm saying? How did you expand your network in such a short time? Because really, we say 4 years and we think, damn, that's a short time for what you've accomplished. I mean, it's a quantum leap. How did you have the guts to go out there and knock on doors and be like, hey, I'm gonna start sending folks to you, answer the phone?
And I think it was literally that. Like, literally, my family nurse practitioner will text me and be like, I need a guy. Yeah. And I'm like, all right, let me do it. I think number one, God sets it up, right? God sets life up. Even when you don't recognize that he's doing it, he's setting it up for the future. So I think that working in the hospital systems, being around individuals, being in certain groups, I was able to connect with certain providers in different systems, right? And build those relationships up. And then those providers introduced me to additional providers, and we built those relationships up. As far as the community resources, I interview them myself. I want to talk to the CEO. I want to talk about what's going on. I want to talk to other individuals that use them. We use a very specific vetting process in order to send patients to them. And if a patient comes back to me and says, I didn't have a good experience, I'm reaching out. We just had this experience with our lab. You know, I had to end up figuring out who is the boss of the labs. All right, now let me get to them, and now let me break this down. And so I think that my staff utilizes me tremendously, and I always tell them, you don't need to argue with nobody. That's my job. And so I'm reaching out to whoever, and I'm, you know, I get this from one of my best friends. She's always like, I don't want to talk to you because you can't do nothing. I need to talk to your boss who can act. And so I think that that's what we've been able to do in this time is make those connections, but also by working in the system, I had already started piecing together individuals I wanted to send people to.
I love it. I love it. Final thoughts, my sister. What do you want to leave for the audience?
So I think the biggest thing is my call to action. And that's what I've been doing across the board lately, my call to action. If you know 4 people in Cleveland that need health care, call them right now. Tell them to call Village of Healing at 216-815-4325 to make their appointment today. If you know 4 foundations, 4 corporations, 4 donors, 4 people that are willing to invest in an organization like mine, reach out to them right now. And this is all in celebration of our 4-year anniversary. Reach out to those 4 people right now. Get them connected with us. Get them in a room with us. Mention our names in those rooms because that's what we need right now.
Let me ask you this as we close out. How can a Black Executive Perspective podcast support and help you? Because there's some young lady, some young man sitting in Portland, Oregon, or Sacramento, California, or Phoenix, Arizona, and they might want a little bit of the game. They might want to have a conversation. Do you have a FAQ section on your website? Is there a way that somebody can glean from your wisdom and your hard work that don't happen to be sitting in Cleveland?
So we do have intake forms on our website. Please go on my website, fill those out. It filters through our staff, and they'll get it to me. Another way is to email us at admin, ADMIN, at villageofhealing.org.
Okay. And the website is villageofhealing.org?
Villageofhealingcle.com.
Okay. Villageofhealingcle.com. That's great.
Yeah.
Well, my sister, we really want to thank you for appearing on a Black Executive Perspective podcast. More importantly, I mean, this is one of my favorite episodes. I'm not just saying it because you're here. I'm just saying it. We've met a lot of people. We've had a lot of people on our show, and they've all done tremendously, and they have great backgrounds, and their stories and their purpose is great, and they're helping people. But you are, like you said, you're a unicorn, right? And the passion and the love and all the things that you're bringing. I wouldn't be, so number one, we want to have you come back on in the near future, right? So we want to keep hearing what's going on at Village of Healing. Number two, I wouldn't be shocked that in a year or two, everything that you're asking for, you're going to get. You're going to get some type of investment. You're going to get, it's just a matter of time, my sister, because I can tell right off the bat, you ain't stopping until you get it, right? And this is something that is scalable. So we're asking anybody who's watching this or listening to this, if this struck a chord, right? And even if you, like Chris said, in Portland, Oregon, or LA, or Phoenix, or Miami, or whatever, and you're not in Cleveland, but you're like, hey, I would love to have something like that in my town. Or more importantly, I want to help promote or just give her something, right, to help her continue to build out. Please go to her website. Please reach out on the email. We'll have it up on our site. Please reach out directly, right, and make a donation. Do something. Maybe you know somebody. Maybe, because it's all, you know how it works. It's people know people who know people, right? But, Dana Langford is really taking her mission, her purpose to the next level. But it's not about her getting a man and getting married and making some money.
That's out the window now.
All right. It's about her helping the sisters be able to have health care and all the things and creating that system. Because that's the big thing here, right? Mm-hmm. The system wasn't built for us, but she created a system that is, and we need to expand that. So Dana Langford, we appreciate you appearing on the Black Executive Perspective podcast.
Thank you all so much. This was an amazing conversation for me. I really appreciate you both.
Well, thank you, my girl. So I think now it's time. Yes, let's do that again. I think it's now time for
Tony's Tidbit.
Okay, and the tidbit today. They took our knowledge, dismissed our pain, and built systems that forgot our names. Yet wisdom never left us. It lived in our grandmothers, and in our midwives, in the quiet strength of women who kept bringing life into the world anyway. The answer was never outside of us. It has always been within the village. When we honor our history and rebuild what has been taken, healing stops being resistance and becomes restoration. And you heard a lot of that from our sister, Dana Langford.
Absolutely. Wonderful message. So, but before we let you get out of here and we wrap up, don't forget to check out all of the shows that we have on the Black Executive Perspective Podcast Network in our portfolio. You want to make sure to check out this week's Need to Know with Dr. Nasinga Burton, where she brings her valuable insights about the world and times and gives it to you straight. We're going to make sure you check out Pull Up, Speak Up, where we have a panel of people with different perspectives and ideas sit and talk about things that matter to us, and they don't avoid the conflict. They actually go in deep. And also, we want you to check out A Mixed Executive Perspective, where Grace Food and Corey explores the identity of being mixed, a leader, a woman, a bi-coastal individual, everything you could think of, with her powerful lens and perspective and her sensitivities. And you got to check that out each week as well. So make sure that you check out the things as well as our show and our Tuesday Live. Every week, we bringing something to you wherever we can. Thank you so much for tuning in.
Absolutely. So no matter what show you tap into, our mission stays the same, making uncomfortable conversations comfortable, different voices, different perspectives, and we have one purpose.
But we will be remiss if we didn't remind you our call to action. She talked about her call to action. We got a call to action too. Our goal is to eliminate all forms of discrimination. And to achieve this, we ask for everyone to embrace LESS, that's less. The L stands for learn. Educate yourself on social, racial, cultural, medical nuances that affect your community. And understand that even with what she's done here, with what Dana's done, she's saying she's opening not only to women, but to men and children of the community, because we all matter. Our lives do mean something, and she's going to help in that spectrum.
Absolutely. And then after you learn, you have the letter E, which stands for empathy. Now, since you've learned, now you can put yourself in the other person's shoes, because now you can see their perspective.
And the first S stands for share, which is what we do here. We share insights and try to enlighten others. We don't hide it, we divide it.
And then the final S stands for stop. We want everyone to stop discrimination as it walks in your path. This is very easy to do. If Aunt Jenny or Uncle Joe says something at the Sunday dinner table that's inappropriate, instead of sitting there with your mouth open or giggling, you say, Aunt Jenny, Uncle Joe, we don't believe that, we don't say that, and you stop it right there. So if everyone can incorporate less, LESS, we'll build a more fair, more understanding world. And guess what? We'll all see the change that we want to see, because less will become more.
Thank you for tuning in again, like Tony said. Thank you, Miss Dana Langford, for showing up. We have a powerhouse, a packed situation of guests that will be coming to you in 26. Make sure you check out the website, sign up for the newsletter, a monthly perspective, so we can tell you what's going on and how it's going. Provide us a review there. Let us know who you'd want to see or what you'd like for us to talk about. And subscribe wherever you're listening to us. Where can they find us, Tony?
My brother, you can find the Black Executive Perspective podcast on YouTube, Apple, Spotify, or wherever you get your podcasts. And don't forget to follow us on our social channels of LinkedIn, X, YouTube, TikTok, Facebook, and Instagram at a Black Exec. For our fabulous guests, all right, the unicorn, Dana Langford. From my boy down in Dallas, the co-host with the most, my boy Chris P. Reed, I'm Tony Tidbit. We talked about it. We definitely learned about it. I didn't know a lot about midwife about it, but guess what? Dana talked about being a unicorn about it. More importantly, we love you. And guess what? We're out.
A Black Executive Perspective.